Now we take off in West Africa, where the Nigerian health authorities have announced an outbreak of diphtheria in the capital, Abuja, after the death of a 4-year-old child. The highly contagious infection can cause breathing difficulties and heart problems that can be fatal, particularly in children. The Nigeria Center for Disease Control and Prevention, the NCDC, said there had been multiple outbreaks across the country since late last year, with almost 800 confirmed cases and at least 80 deaths. It said the vast majority of cases were among people who had not been vaccinated, despite diphtheria being covered by the country's routine childhood immunization program. Now, joining me on the news to discuss this development is a virologist, Dr. Oladipo Kolawole. Thank you, doctor, for joining me on the news.
It's this time of the day.
All right, we're talking about diphtheria. The Nigerian health authorities have announced the outbreak of the disease in Abuja, the nation's capital. What are the possible symptoms to look out for? From what we understand, it's a very, very contagious disease.
Yeah, it's a very contagious disease. And from the scratch, when we talk about diphtheria, is caused by a bacterium called Corynebacterium diptheria. And one of the things that we should understand is that this bacteria really has the potential of releasing toxins into the body system, whereby having a negative impact on the health of such an individual. One funny thing about this disease is that it's a vaccine preventable disease, in which if one is fully vaccinated, it is preventable. So seeing it around, it means we still have a lot to do as regard our vaccination. That is what I can talk about based on the question you just asked now.
Okay, now the NCDC, that's the Nigeria Center for Disease Control and Prevention, had said that there had been multiple outbreaks across the country since last year. Looking at how viral the issue is, looking at how very contagious it is, why is it that no major precautionary measures were taken? And what are ways to prevent the spread, to curb the spread in the country?
Yeah, one of the ways rather to curb the spread, first of all, we need to understand how the disease, the infectious disease, how it actually spread. This diphtheria spread through person to person. And if someone is infected and another person non-infected and maybe not vaccinated or not fully vaccinated, get in contact, close contact with such an individual, such a person is able to pick up or catch, get infected from the disease, then the bacterium can be transmitted through respiratory droplets, either sneezing or coughing. And don't forget that during the outbreak of COVID-19 for now, a lot of people have lowered their guards in terms of health concern in preventing such a disease. So now that we have that in the community, it is expected of us to know that people need to be vaccinated, people need to be educated to know the means and ways in which they can be infected with these bacteria that we are talking about. So if we are able to sensitize our community in this regard, there will be ways that these can be prevented. And we have seen cases across Nigeria as reported by NCDC, but more work needs to be done for us to actually sensitize our community that this bacterium is around us and we need not to lower our guards so that we don't get infected. And it affects respiratory or the skin. So that is one way. And most of the symptoms, you can be seeing something like weakness, sore throat, and mild fever. And when we talk about fever, we are talking about the abnormal body temperature. Then some of the time, individual can, I will call a swelling of the neck. And those are the things that you actually see when somebody is having a diphtheria.
Now, it is said that it is spread across the vast majority of cases in the country. Now, does this cover both adults and children, or just adults? What exactly is the target?
Now, if you look at the bacterium, looking at the vaccination schedule for children, there is something we call DPT. That is a pentavalent vaccine that cut across diphtheria, pertussis, and tetanus. So what we need to understand is that for children, we have 6 weeks of birth. Then there's another 4 weeks interval, making 10 weeks. Then we have another interval making of another 4 weeks interval, making 14 weeks. That is the immunization schedule for children to get the vaccine. Then we have another booster. That one comes within 4 to 7 years. Then we have another second booster within 9 to 15 years thereabout. So the question is, after getting the vaccination for maybe the 6 weeks, the 10 weeks, and the 14 weeks, how many individuals do get those boosters? And the essence of getting booster is to stimulate the immune responses to have enough neutralizing antibodies that we're able to fight against the infection whenever the bacterium have its way into the body. So if I have been vaccinated, I didn't get my booster, it means I'm not fully vaccinated. And also for the adult too, there is another special vaccine for the adult. So both the children and the adults need to be vaccinated. So what I can infer personally is that we need to work on our immunization, the immunization routine schedule very well, because if we work on it, it will be easier for us to prevent any vaccine preventable disease from being occurring in our community.
All right, virologist in Nigeria, Dr. Oladipo Kolawole, thank you so much for joining us in the news.
Thank you for having me.